I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Good morning and welcome to our regularly scheduled meeting of the Board of County Commissioners, March 5th, 2024. My name is Andy Hunthausen. To my left, Commissioner Tom Rolfe. Good morning.
Good morning, Mr. Chairman.
Flo Liston, taking care of us today. Good morning, Flo. And to my right, our special guest today, it is not Commissioner Payne, as you can see. It is Rex Welts, the Superintendent of Helena Public Schools. Good morning and welcome. We'll explain this a little more in a minute, but good morning.
Good morning. Thanks for having me.
To Superintendent's right is Nico Hash, Deputy County Attorney. Good morning. And Roger Baltz, our Chief Administrative Officer. We do have a sign-in sheet in the front as well as agenda. So those that are here, please sign in prior to leaving. The reason we were kind of watching the clock and there, just an explanation of the superintendent. We are televised, so we're on TV time. You know, I think it's one of the better reality TV shows, right? That's right. Okay. So we'll start with consent action items. We don't have any, so I'll use the time to explain why our superintendent is here today. And it is a kind of a special event, special occasion. The Helena Education Foundation, on occasion, they normally would do it every couple of years. They had a little hiatus during COVID, but back to normal operations. They try to match the administrators in the district and those that run our Helena School District with leaders in the community, and they do some job shadowing or partnering. So this morning, the superintendent will spend the morning with me. And this afternoon, I'll get to go and hang out in his world and find out what he does. So good morning. I don't know if you have further explanation about that, Superintendent, but welcome.
Thank you. Yeah, I think the same piece. I've been in the district nearly 4 years, and it's the first time we've been able to trade places. So honored to be here. Look forward to this morning. I feel bad I may put you to sleep in the afternoon when you join my side. We're going through policy and budget meetings. So
great.
Drink some coffee.
Well, it'll probably be very similar to our world. So thank you very much for being here. Glad to have you. We will start with item number 3 now, a task order number 11 between Lewis and Clark County and the Great West Engineering. Mr. Karlin, good morning.
Good morning, Mr. Chair, Commissioners. Dan Karlin, County Engineer for the record. Before you today is task order number 11 with Great West Engineering to perform preliminary design services to relocate the existing above ground storage tanks, or ASTs, to the west side of the Public Works complex. The existing magnesium chloride, or MgCl tanks, are past their useful life and will be replaced with new tanks and also relocated to the west side of the complex. Scope of work includes data collection, field survey, owner and stakeholder coordination, turning movement verification, vendor coordination, and drafting for both tank systems. The fuel system preliminary design will assess the feasibility of relocating the existing ASTs. The MAG system design will include storage and mixing tanks, piping configuration, valve configuration, pumping equipment, concrete slab, and concrete secondary containment elements. Preliminary construction plans and specifications will be developed to include site work, concrete, fencing, fuel system components, magnesium chloride system components, and necessary electrical systems. The preliminary plans and specifications will be used to develop preliminary construction cost estimates. The task order is for time and materials not to exceed $39,100 and is being funded through an American Rescue Plan Act grant. Staff recommends the Board of County Commissioners approve task order number 11 with Great West Engineering in the amount of $39,100 with a contract end date of May 31st, 2024, and authorize the chair to sign. And I can answer questions if you have them.
Thank you, Mr. Karlin. Questions, Commissioner?
We might just tell the public a little bit more about the reasons for moving and how it'll work in the long-term plans.
Yes, Mr. Chair, Commissioner Rolfe. So about 2 years ago, we undertook a Public Works master plan process to kind of look at whether we can stay where we're at going into the future, kind of a 20 to 30 year time horizon, or if we need to investigate moving the Public Works complex. In that process, kind of through the charrettes and all of that, it kind of was outlined that we could stay there into the future, but there were some adjustments we would need to make. One of those primary elements, kind of the first phase of all that, was to move our fuel system and magnesium tanks to the west side of the complex to open up that area for future buildings, things like that. Also for traffic flow and safety reasons as well. One of the primary pieces of that is we'd be able to allow the other users of the fuel system to access just from the west as opposed to driving through the entire complex. It's really a safety thing. Fewer vehicles we can get moving through there, the better, with all the heavy machinery and things like that. So that's the reason for the fuel tanks primarily. The magnesium chloride tanks, they've been in place for going beyond 20 years now. They're beyond their useful life. Some of the piping is struggling a little bit. Some of the pumps have been replaced. Moving those to the west side has two impacts. One, it's easier for deliveries. It's also the appropriate time to replace them due to their aging life. And thirdly, it will help out the Florence Crittenton facility to our east. There's some requirements from HUD, Housing and Urban Development, that something similar to, sorry, that's the fuel tanks. It helps HUD if we move our fuel tanks, the ASTs, to the west side. There's some distance requirements that they have. So that'll help them with that. Again, the mag tanks moving, that's primarily for functionality as well as ease of use, and they're just past their lifeline, or life span. There we go. That's the right word. So yeah.
Thank you.
Great. And I would just ask or add to that, just a little bit of description for those that may not know what we're talking about. These tanks are how big? What do we use magnesium chloride for? And we're talking about the Public Works Complex.
Absolutely, Mr. Chair, Commissioner. So magnesium chloride is it's a salt, it's a brine product that we use for a couple different reasons. First off, the tanks are, I believe they're 500 gallons each. No, that's not right. 5,000 gallons each. They're a lot bigger than that. So they hold quite a bit of fluid, brine. We use that for two reasons. Primarily in the summer, we use it for dust mitigation. It holds down the fine particles, the fines of the material that's on our gravel roads. So it keeps that tight. That also has the secondary, or in my world, primary impact of stabilizing the soil. It holds it in place so we're not losing that material that we've put down to the wind. We tend to get around here in Augusta and other places. So it holds that material in place better. It prevents potholes. When we get a rain, it holds the crown of our road more stable so that water can shed off more easily and appropriately so that we don't develop those ruts. It becomes less muddy in the end because less water is sitting on the surface. So multiple reasons why we use the magnesium chloride.
Thank you. Any other questions?
None.
Okay. Thank you, Mr. Karlin. Any public comment on this item? Any public comment? Any public comment? Seeing no public coming forward, Commissioner, is there a motion, please?
Mr. Chair, I would move to accept task order number 11 between Lewis and Clark County and Great West Engineering as explained by Mr. Karlin.
Second, moved and seconded to approve the task order as presented. Any further discussion?
None.
Thank you, Mr. Karlin. I think you mentioned that this is funded by ARPA funding, or at least partially by ARPA funding that we received, and we've been intending to make this move or plan for this move for quite a while. We've got a master plan, or that sorts of a master plan that we've been working with on that site, and we're trying to move forward and renovate, change things around a bit there so they're more functional, usable, and we have some better durability and duration for the Public Works Complex. So thank you. It's all part of the plan is what I meant to say. I could have said that in a couple of words. Commissioner, anything else?
Nothing.
All in favor of the motion signify by saying aye.
Aye.
Aye. Thank you very much. Next item on the agenda is a grant award to Lewis and Clark County from National Environmental Health Association. Good morning.
Good morning, Mr. Chair, Commissioner. I am Laurel Riek, Administrator for the Environmental Health and Disease Prevention Division in Lewis and Clark Public Health. We have been awarded a grant from the National Environmental Health Association in partnership with the U.S. Food and Drug Administration, totaling $12,500. The NEHA-FDA Retail Flexible Funding Model Grant Program, as we, so I was going to say, using the least words possible to describe the grant.
We want to explain it well, so you're okay.
So this program provides funding to retail food regulatory agencies as they advance conformance with the retail food program standards. There are 9 standards developed with input from federal, state, and local regulatory officials, as well as industry, trade, and professional associations, academia, and consumers on what constitutes a highly effective and responsive retail food regulatory program. They are intended to provide a high quality and consistent retail food program across the United States that works to reduce the number of foodborne illness risk factor violations observed in our regular routine inspections. All of this work helps us to meet the standards of the Public Health Accreditation Board. Lewis and Clark Public Health has been accredited since 2017. The first part of the application is for a fixed award of $5,000 to continue working on Standard 2 beginning January 1st, 2024 and ending December 30th, 2024. The focus of this standard is to develop and maintain a training program for our regulatory staff to ensure that they have the knowledge, skills, and ability to adequately perform their required duties. We will maintain our record keeping for training of our regulatory staff and standardize at least one of our inspectors using the FDA standardization procedures. This process evaluates the inspector's ability to apply the knowledge and skills obtained from the training curriculum, the joint inspections, and independent inspections. The process requires the trainer and the trainee to devote extra time and effort to conducting these inspections and their evaluation. The grant will help offset the required time and costs of these efforts. The second part is an add-on grant application of $7,500 to fund training opportunities for the inspection team and the supervisor, beginning again January 1st, 2024 and ending December 30th, 24. This will provide continuing education for our retail food team that is required by our credentialing agencies and will help us to meet the requirement of Standard 2 for a well-trained and standardized staff. This can be used for travel and registration costs associated with training specific to retail food programs. There are many opportunities available to the team this year, and we look forward to making that happen. Staff does recommend approval of the grant award.
Thank you very much. Questions, Commissioner?
Just really appreciate your going through all these acronyms. But Commissioner Payne is usually the one that wants them all explained, and in her absence, I think we need to make sure that they are properly explained to the public. But instead of the NEHA-FDA Rough'em Act, it's the National Environmental Health Association, U.S. Food and Drug Administration Retail Flexible Funding Model.
Wow.
Wow. Thank you.
Short name.
Yeah, thank you very much. Important. We've had some significant discussions the last few weeks. MACO, it was good discussion. I'm on the Health and Human Services Committee at MACO, and we discussed the license establishment fees, kinds of things. And one of the things that came up as a theme from commissioners across the state is that there's a real lack of sanitarians and folks to do this work, professionals that are able to inspect and do the food safety work around our communities. And so it's a big concern. I think the universities have both been involved. I think the public health program in Missoula and maybe at MSU as well. I don't know for sure, but they're talking about really trying to, work on the workforce, lack of workforce, I guess, which is a theme across many professions, but this is one of them. And a little off target here, but it's related and I think important. So all the training we can get, we have to have the professionals to do that training for as well. So I appreciate you bringing it forward. And if the public wants more information about how this works and how our food safety program works, they can find some information on the public health website, correct?
That is correct. It is on our public health website. You can reach out to our staff and they would be happy to answer any questions.
Great. Okay.
Good.
Commissioner, any other questions?
None.
Any public comment on this item? Any public comment? Any public comment? Hearing none, is there a motion, please?
Mr. Chair, I would move to accept the grant award to Lewis and Clark County from the National Environmental Health Association as explained by Ms. Riek.
Second, moved and second to approve the grant award as presented. Further discussion, Commissioner.
I just think it's important for the public to know that the work we do to inspect and keep public food distribution safe is not nearly paid for by the amounts of fees that we can collect per the legislature, and we need to continue to work with the legislature to make more of this make this a self-funding thing. Either get a substantial legislative allotment to help pay for this, or to allow us to raise the fees that in order to make it a pay-as-you-go operation. So hopefully the legislature will listen to us and make a difference.
Thank you, Commissioner. And I'll just add to that, you know, we bring up this topic, so it gives us opportunity to get on our pedestal here, our soapbox. And we just discussed this at MACO, and it is across the state. Health departments are frustrated. Our licensed establishment programs are frustrated with the amount of funding. So in essence, we go out and we inspect all pools, restaurants, schools, nursing homes, any kinds of licensed establishment with food and or where there's some sort of safety risk. There's a list of them that we're required to inspect. And part of the way that we fund that inspection regime is by licensed fees. The establishments pay part of that. This last year in Lewis and Clark County, we received about $62,000 in fees, yet the program cost us about $385,000 to administer. And so that's out of balance. As I said at the MACO meeting, it's appropriate for the taxpayer to do their part because we're keeping these facilities safe for them. However, those establishments as well contributing to that. I think normally it's about $100 for annual inspection, and it doesn't come close to covering much of the cost of the person being there for several hours and going through a program. And then if there's a problem, working with them and trying to fix that and develop a plan and all of that. So it's one of those equalization things that we're hoping to work on with the legislature, and that they would either help us raise those fees a little bit and or invest some money, as Commissioner Rolfe said. So with that said, we'll get back to this. We have a motion and a second on the table for a grant award to Lewis and Clark County from the National Environmental Health Association. Appreciate you bringing this forward. We had no public comment. We have a motion, a second. All those in favor signify by saying aye.
Aye.
Aye. Thank you very much. Thanks for letting us get off target a little bit there. Appreciate that. We need to do it when we can. Okay. Next item on the agenda is a grant task order 24-07-4-31-123-0, amendment number 1 between Lewis and Clark County and the Montana Department of Public Health and Human Services. Riek.
Good morning again. For the record, I am Laurel Riek, Environmental Health and Disease Prevention Division Administrator with Lewis and Clark Public Health. Today, I have before you a task order amendment number 1 for immunization services between Montana Department of Public Health and Human Services and Lewis and Clark Public Health. The original task order was for $31,190. This task order adds $328,768 for COVID immunization services that will be dispersed upon full execution of the amendment for a total of $359,956. The purpose of this task order is to provide support to reduce the burden of vaccine preventable diseases with Lewis and Clark County, within Lewis and Clark County by ensuring the oversight and provision of immunization services for children, adolescents, and adults throughout the county. The services added by this amendment to the task order include identifying additional programs and partners within local jurisdictions and develop partnerships for routine vaccine outreach, education, and planning that also includes COVID-19. We would do this by partnering with other programs to develop and disseminate materials for vaccine confidence and education to underserved populations. This would include our WIC program within our health department. We would also develop community outreach programs through community coalitions or organizations, patient navigators, and/or other local programs. Another service would be added that would create outreach programs and increase organizational capacity to provide opportunities for routine vaccination in socially vulnerable populations that again includes COVID-19. We would regularly provide outreach to county jails, detention centers to provide vaccination services or ensure that residents have access to those services through other contracts. We would maintain a walk-in availability for vaccinations that also includes COVID-19. We would regularly provide outreach to long-term care facilities and other high-risk congregate care settings, or ensuring residents have access to those services, again, through other contractors. It provides funding for professional development, training, and recruitment to ensure a workforce that is proficient in providing services to at-risk communities and areas of high social vulnerability. It increases the access to routine vaccines, including COVID-19, by continuing to fund, host, or organize vaccination pop-up clinics that focus on at-risk communities of areas of high social vulnerability. With that, we do recommend approval. I would be happy to answer any questions that you have.
Thank you very much. Questions, Commissioner? Any questions?
It is, if I understand this right, this is kind of a continuation of what we've been doing, or is this completely new more money?
It's a new money. In the past, our immunization services have been funded by a grant of $31,000 a year or less. And this adds over $300,000.
Okay.
It's a one-time disbursement for this activity to really get the community to continue the work that we do.
Great. Thank you.
Thank you very much. So you talked about special populations, those kinds of things. That might be nursing homes, could be other vulnerable populations that might not normally be in a vaccination
Easily
program.
accessible.
Right.
Yeah, so we would be high-risk populations would include our detention center, our shelters, poverty areas, but it would also include YWCA, Head Start, pre-release centers. I mean, there's a wide variety of places that we reach out to.
Right. Yeah, thanks for clarifying that. I wanted to kind of get that out there as well. It's important work, and some of these populations may be under vaccinated or have not had the opportunity for vaccination. So, okay, great. Thank you very much. Commissioner, anything else?
Nothing.
Okay, any public comment on this item? Any public comment? Hearing none, is there a motion to approve the task order as presented?
Mr. Chair, I would move to approve the grant task order 24-07-4-31-123-0, amendment number 1 between Lewis and Clark County and Montana Department of Public Health and Human Services, as explained by Ms. Riek.
Second, moved and seconded to approve the task order as presented. Further discussion?
No.
Thank you, and thanks to our partnership with Department of Health and Human Services. These funds, I'm assuming, are coming down around the state, and opportunities for counties to get out there and make sure our populations are kept safe. Thank you. With that, Commissioner, all in favor of the motion signify by saying aye.
Aye.
Aye. Thank you. Okay, we had a relatively short agenda today. We are at that time in our meeting where we will take public comment on any item that is under the jurisdiction of the commission, but not on today's agenda. Any public comment? Any public comment? No public coming forward. We'll say one more time, thank you to Superintendent Welts for joining us. And I didn't give your stats today, really. You were a teacher and
Principal, superintendent.
so, but you
Coach.
started a science teacher, right? Science teacher and coach?
Did, so
Right,
1994
you
started.
tell it.
Yeah,
You
you got it.
better than I.
I'll give you the quick version of that, without acronyms. We had, started in teaching high school in the Bitterroot Valley, 1994. Spent 5 great years in the Bitterroot. Family and I moved to Alaska. We were there for 10 years. I was high school science teacher, basketball coach, fought fires in the summer, did a lot, and then went to Alaska for 10, got my admin degree, and as a high school teacher, then found myself as an elementary principal. Since that time in Alaska, father was real sick with some cancer, and we flew out a lot, just knew that we needed to get closer to home. And so I took a high school principal job down in Forks, Washington. I was there for several years, more sickness in the family. We wanted to get closer, that desire to come back home to Montana. And so found myself as a high school principal in Polson, Montana. I was there for 8 years, 4 as a high school principal, 4 as a superintendent, and then made my move to this great community in Helena. And so I was at Rossiter for a year, less than a year, and I thought that was for my ever job, being around kids, and really found my happy place. And then the superintendent left here in Helena, and I applied for the position, and I now about 4 years, 3.5 years as superintendent here in Helena. So it's been a great ride.
Good. Well, we're glad you're with us today and looking
Thank you.
forward to the rest of the day with you. Thank you for being here.
Thanks for having me.
Anything else for the good of the order? Anybody? Anything you want to add? Okay, with that, we will stand adjourned. Thank you all.